I'm Kate Czaplinski for the HAN Network. May is Mental Health Awareness Month, and we're helping to raise awareness and start a conversation here at Silver Hill Hospital in New Canaan. I'm joined right now by Dr. John Douglas, who is the Clinical Director for the Outpatient Addiction Program. Dr. Douglas, thanks for joining us today.
Thank you very much. Thanks for having me.
And we're talking about a very important topic today, which is heroin in the suburbs. And I think for many people, the idea they have of a heroin user is someone in an alley, is, dirty. And now that's kind of changing. The face of that is changing. What is the new face of heroin use?
Yeah, so I really appreciate that question because the demographics of heroin use are really changing. And traditionally, it has been more common in inner city environments among the population you described. But now heroin use is really growing in many different demographics, and it affects people of all ages, races, sexes, income levels. But it is particularly growing fastest among white young adults ages 18 to 25 who live in suburban communities.
And what has changed? I mean, what's kind of brought more attention to this drug? What's happened?
Well, why it's getting more attention is a complicated question that has a lot of factors to it that researchers are actually currently looking into. But one of the reasons heroin use is growing so much is that our country is being flooded with heroin, and the amount of heroin that's available is really staggering now. And that is really lowering the cost of heroin to make it very cheap. And drug dealers are looking to expand their markets. And white young adults who live in the suburbs are an attractive target because they usually have access to money and a place where they can use privately out of sight from law enforcement.
Now, what is the path to heroin addiction? Does it go right to heroin, or are there other drugs first? Tell us how that happens.
So that's a great question as well. So somewhat like your question is alluding to, heroin is not usually the drug that someone tries first. And actually, substance use for most people who have addictive disorders starts in adolescence under social pressure. And people usually start with the substances that are most widely available, like alcohol, cigarettes, and marijuana. And the longer they associate with people who use substances, the more likely they are to move on to trying other substances. And some of the next most available substances are prescription medications, which include pain pills like OxyContin or oxycodone. And people usually, when they first are trying those substances, they are getting them for free from relatives or friends. And very often they'll even be taking them from medicine cabinets and just finding them where they can. By the time that free supply runs out, though, they have often developed an addiction to the opioids, and then they turn to trying to buy the pain pills from drug dealers. They find that the pain pills are much more expensive, and then they switch to heroin mainly due to cost.
Now, there's been some crackdown, obviously, on prescription drugs. Does that in any way correlate to the rise we're seeing in heroin use?
That's an interesting question, too. So there is definitely, they're trying to curb the amount of prescription painkillers that are being prescribed, which really ramped up when pharmaceutical companies in the 90s really started marketing them heavily, and we were dealing with the after effects of that marketing campaign. As far as how that's connected to the heroin use, I'm not sure it's really clear, like how those policies are curbing the heroin use, and it's hard to tell, especially because we're not curbing the amount of heroin coming into the country.
And let's talk a little bit. You mentioned cost. Let's talk about buying heroin on the street maybe versus buying prescription pills. What's the cost difference there?
So that's a great question, too. So the cost of prescription pills and heroin can vary depending on your region, but for prescription pills, it can be between $40, $60 a pill, which you compare that to a bag of heroin, which often goes for about $10 a bag, which is cheaper than a pack of cigarettes. So and it's important to note that pain pills and heroin work exactly the same. They have the same mechanism. So just from the consumer standpoint, once they become open to heroin, they get the same effect and they can get a lot more for their money, which drives that switch.
How easy is it in, say, a beautiful town like New Canaan, we're in Fairfield County, how easy is it to get access to these kinds of drugs?
Well, personally, I've never seen it, but in just going around the community. But we have numerous patients from this community who find it readily accessible. So I think for the person who's just kind of living their life in the suburban community, they may never see it. But for someone who is searching it out, it is readily available.
And what can parents do, or just any, loved ones do for the people in their lives that they're worried could fall down this addiction hole?
So that's a great question. I get that question a lot, actually. And I would say there's two different ways to approach that question. There's one is how to prevent your loved one from ever being addicted, which is the ideal path. That would be the easiest path, is to stop it before it starts. And the best way for parents to do that is to set clear expectations of their children's and adolescents to not use any substances during those times. And that includes alcohol. And it's been shown actually that when someone delays initiation of alcohol or drug use by a year, for every year they delay that, they decrease the chance of developing an addictive disorder by 5%. So that can be very challenging in our culture today, where drinking alcohol is quite prevalent. But the best advice I have for parents is to set a firm expectation for their children to not use alcohol or drugs during childhood or adolescence. And that is the best way to prevent them from developing an addictive disorder. As far as once this disorder takes hold and once they are concerned that their child may be addicted, the best possible thing they could do is not do this on their own and engage their child in treatment. And so you want to get them into treatment as quickly as possible and follow the recommendations of the treatment team.
Now let's talk a little bit about prescription pills that people might have in their cabinets. What should they do with those? So
I think this focus on heroin and prescription pills is really scaring a lot of people, and I know a lot of people are very concerned. And it's a very good topic to be talking about, becoming aware of the danger. But I think sometimes the impression that prescription pills are just other drugs that people are abusing it's a confusing message. Mm-hmm. And so most people who use prescription pain pills are not abusing them. They are using them legitimately for the purposes of controlling pain. But the problem is they should be used in most cases to control acute pain. And when people stay on them for a long period of time, they often accumulate prescriptions, and that is when they sometimes get into the wrong hands. And so if you have prescriptions for painkillers that are old and lying around the house, you should discard your old medications. And you should be very mindful of where you keep medications which can be abused, and know that people who abuse them may be going through your medicine cabinet. So you should be thinking, should I keep this under a locked medicine cabinet where perhaps children and other people can't have access to it? So people should get rid of their old prescriptions, which you can just throw them in the trash. And if you need to keep those prescriptions, you should be mindful that they may be abused, and keep them locked if you have people in the house that you don't want to have access to your medications.
That's really great advice, Dr. Douglas. Is there anything else we should keep in mind just when starting to address this growing heroin issue in the suburbs?
The main thing I would just encourage people to know is that they are not alone, and that this problem is affecting numerous people all throughout our country. And it's a problem that needs to be tackled, and it is also a problem that will not go away without professional help. Heroin, pain pills, they're some of the most addictive drugs in the world, and it does take professional help to have a sustained, long-lasting recovery.
All right, well, Dr. Douglas, thank you so much for talking with us today. We really appreciate it.
No, it's my pleasure. Thanks for having me.
All right. Well, if you want to see more of our coverage on mental health awareness this month with Silver Hill Hospital, you can visit han.network. We'll see you next time.